If your back hurts after 60 and a doctor said it is just arthritis, there is a real chance they were completely wrong. Arthritis gets the blame for almost every back problem after 60, but it is rarely the true cause of your pain. The real cause progresses faster, damages more, and needs completely different treatment than arthritis does or will. And here is why this matters so much. Treating the wrong thing means the real damage keeps getting worse every day. Most people spend years treating arthritis, while the actual problem quietly destroys more of their spine each month. In the next few minutes, I will show you what is actually destroying your back after 60 and what to do about it. I am Dr. Edward. This channel gives you honest health information that protects your spine every day after 60. Let me show you what is happening in your spine, because once you understand this, you will know exactly what to do. Arthritis of the spine, osteoarthritis, involves cartilage breakdown between the small joints of your vertebrae. It produces a dull, aching stiffness that is typically worse in the morning and improves as you move throughout the day. Arthritis pain rarely shoots down the leg, rarely sharpens with walking, and rarely comes on suddenly without warning. If your back pain does any of those things, arthritis is almost certainly not the cause of what you are feeling. So, what is the real cause? There are 4, and most people have at least 2 of them happening simultaneously. The first and most missed real cause is spinal stenosis, a narrowing of the spinal canal that compresses your nerves. That narrowing puts direct pressure on the nerve roots that branch out from your spinal cord to your entire lower body. Spinal stenosis affects over 70% of adults, over 60 most, without ever receiving a proper clear diagnosis. The classic sign of spinal stenosis is pain or weakness that comes on specifically when you are standing or walking. The moment you sit down, the pain eases, sometimes almost instantly, and that pattern is the signature of stenosis. Many people with spinal stenosis lean forward on a shopping cart or bend slightly as they walk to find relief. That forward lean opens the spinal canal and reduces the pressure on your nerve roots, and your body figured it out first. If any of this sounds familiar, the sitting relief, the forward lean stenosis, is likely part of your problem. The second and most destructive real cause is vertebral compression fractures from osteoporosis, and they are silent. 1 in 3 women over 65 and 1 in 5 men over 70 will have a compression fracture, many never even knowing it. These fractures can occur during something as minor as a sneeze, a cough, or bending to pick something up off the floor. They cause sudden, severe back pain that many people attribute to a muscle strain and then never investigate further. Each untreated compression fracture raises the risk of the next one and slowly collapses the height of your vertebrae. This is what creates the progressive hunching and height loss that most people assume is just a natural part of aging. It is not inevitable. It is a consequence of undiagnosed and untreated osteoporosis, and it absolutely can be stopped. The third real cause is sarcopenic back, the progressive loss of the deep spinal muscles that stabilize your vertebrae. After 60, you lose 3 to 5% of muscle mass per decade, and the deep spinal muscles go early and quietly. These are not visible muscles. They are small and deep, running between individual vertebrae, providing constant support. When they weaken, your vertebrae shift slightly with every movement, creating inflammation, nerve irritation, and pain. This is why back pain after 60 so often appears without a clear injury. The support system simply eroded beneath you. 34. The fourth cause is disc dehydration. After 60, your discs lose water content and lose their shock-absorbing height. Discs act as shock absorbers between your vertebrae, and when they dehydrate, they lose that cushioning function. The vertebrae above and below begin sitting closer together, shifting position, and compressing the nerves between them. This produces inflammation and pain that feels exactly like arthritis. But it is a completely different structural problem. Treating it like arthritis will not work, and standard arthritis treatment can actually make disc problems worse. Here is what makes this critical and fixable. Every single one of these 4 causes has real and practical solutions. But the solutions require getting the right diagnosis first. And that starts with the right imaging test, not an X-ray. An X-ray shows bone. It shows arthritis, but it completely misses stenosis, disc dehydration, and muscle volume loss. An MRI of the lumbar spine is the only test that can reveal all 4 causes clearly, and it is the test you need. Before I walk you through the 5 steps, I want to ask you something important before we continue any further today. If this video is helping you understand your back pain in a new way, please subscribe and tap the bell right now. And after the 5 steps, type 1 in the comments so I know this reached you and made a real difference for you. Step 1. Get the right diagnosis with an MRI, not an X-ray, and ask your doctor to evaluate for all 4 causes. Ask specifically for evaluation of stenosis, disc degeneration, vertebral fractures, and paraspinal muscle volume. If your current doctor will not order this, a physiatrist, a specialist in musculoskeletal medicine absolutely will. Step 2. Begin spinal stabilization exercises, because rebuilding those deep muscles is the most powerful treatment. Not sit-ups, not crunches. These worsen disc problems and stenosis. Specific deep muscle exercises are what you need. The exercises that work are dead bugs, bird dogs, pelvic tilts, and McGill's Big 3 performed daily at home. McGill's Big 3 curl-up, side plank, and bird dog were specifically developed for exactly this type of back pain. Performed consistently for 4 to 6 weeks, these produce measurable improvements in both stability and pain levels. Step 3. Address osteoporosis risk, because if compression fractures are involved, bone density is the priority. Ask your doctor for a DEXA bone density scan, the only test that directly measures your bone density and fracture risk. Calcium, vitamin D3, weight-bearing exercise, and sometimes medication protect your vertebral bone density effectively. If you have lost height or noticed progressive rounding of your back, get this scan before your next fracture occurs. Step 4. Hydrate your discs deliberately, because dehydrated discs respond directly to consistent water and movement. Your discs have no blood vessels. They rehydrate by absorbing fluid during movement, not during rest at all today. This means deliberate, gentle movement throughout your day, not rest, is the medicine that your discs actually need. Drinking adequate water, walking regularly, and doing gentle spinal movement all help rehydrate your discs over time. Step 5. Modify the positions and movements that are compressing your spine every day without you realizing it. Prolonged sitting with a rounded lower back is the most compressive disc position. Most people hold it for hours daily. A lumbar support cushion immediately reduces that compression, one of the simplest changes you can make, starting today. Standing breaks every 30 minutes, even just 60 seconds. Allow your discs to rehydrate and your muscles to fully reset. The hip hinge bending from hips, not the spine, when lifting dramatically reduces disc compression every single time. Most back injuries after 60 happen during lifting, and the hip hinge is a skill that prevents them almost completely. Right MRI diagnosis, deep muscle rebuilding, bone protection, disc hydration, and position correction. The 5 steps. None of these require surgery, injections, or long-term medication to begin making a measurable difference right now. One more thing before you go. Something that surprises almost everyone with back pain after 60 and changes everything. Rest makes most back pain worse, not better. Bed rest allows deep spinal muscles to weaken and discs to dehydrate faster. The instinct to protect a painful back by resting is understandable, but movement is more healing than rest every time. Even on a bad pain day, a slow 10-minute walk produces more healing than several hours of rest in any position. Your back is not telling you to stop, it is telling you to move differently and with much better mechanics every day. If this video helped you understand your back in a way that years of treatment never did, type 1 in the comments. Share this with someone over 60 who accepted arthritis as the answer they deserve to know what is actually happening. The video on screen covers another common condition after 60, that gets the wrong diagnosis and is just as fixable. I will see you there, and I hope today is the day you stop treating the wrong thing and start healing the right one.